I was one of those unfortunate parents that didn't have palliative care early on. Actually, we didn't get palliative care until my son's last month of life.
I felt so alone for so long with my son's diagnosis, and I felt like such a misfit everywhere we went.
My career became my daughter's health. I lost my identity, and all I was consumed with was appointments and being a ringleader of care, and your whole life's upside down. You lose yourself in this. I've sat at a table full of many different specialties telling me that there's no one like my child. She's rare. We don't know what her future looks like.
We would ask this subspecialist about this medical decision, and they would sort of give us an answer that was based on just their little tiny piece of ego. And we would say, but what is your thought about this specific intervention in the context of all of ego's other complexities? Who can help us? We are the only ones who are like tasked with making decisions for this whole human being.
None of them were talking to each other like we would have liked them to. And so we always felt like that was part of the care that was getting either missed or dropped, because we as the parents were putting all these puzzle pieces together.
The hard part is you want to do the best for your child. And suddenly you're not so sure what is the best for your child.
You tend to be talked at instead of being talked to. And when that team came in, the biggest thing was that they communicated.
It was not until we found a complex care team and a palliative care team did that team stop and say, how are you doing as parents? What can we do for your child?
We met the doctors who were looking at Vigo's entire life and his quality of life.
Palliative care was the light in the darkest time of our lives. You may not be able to change the diagnosis or the outcome, but the amount of support you get through that can really save people's sanity. It can have better health outcomes.
The palliative care team provided to us the missing piece of the puzzle, the support, the expertise, and the patience that is required.
They are the point to where all of the legs of her care are, and they bring everyone together and help us understand Chloe's condition while everyone else tells us they don't know.
That team was the backbone to empowering us to live the best possible life that we could, caring for these children.
I am excited to be a parent champion, because being a champion is going to give a voice to families like mine.
To have a network of other caregivers or parents is just incredibly important to me, because I could just continue to do it on my own, but to be able to expand that space.
Really helping parents to be advocates for their own kids, no matter where they are on the journey. I didn't take a class to become a parent advocate. I had to learn it doctor's appointment by doctor's appointment, hospital stay by hospital stay.
My son passed away last summer. He lived to age 6 months. And this is the way I keep parenting Vigo, is that I get to tell his story, and I also get to connect with other families. He stays alive with me when I can step into that gap with others and for others. It's deeply meaningful work for me as a mother.